Hi everyone, I'm Dr. Wei from the Fall Prevention Center at Changhua Christian Hospital. Falls are a common problem in older people or hospitalized patients. Patients suffering from cancer, stroke, uremia, movement difficulties, and unsteady gait have a high risk of falling. Once a fall occurs, minor injuries result in fear of falling again, fear of walking, and loss of confidence in movement. Severe cases, bone fracture, brain hemorrhage, or even death. Prevention is better than cure, but what are the best methods to prevent falling? First, one must understand the patient's health condition, drug usage, and environment that may lead to dangerous falls. Second, caregivers should undergo fall prevention training to always pay attention to the patient's activity, especially getting out of bed, moving, and accompanying the patient to the toilet and bathroom. Third, when leaving the patient, always fill out the caregiver leaves patient status confirmation form. Go over the steps of fall prevention again. Finally, encourage patients to undergo physical therapy training, such as TheraBand exercises that can improve the muscle strength and endurance of the limb so that falls are less likely to occur. Let's care about the issue of falling patients together. We all want to see happy, healthy, and resilient patients.
The definition of falling: when patients fall to a lower position or surface due to an accident. Reasons for falling: instability, over the age of 65, use of drugs that can cause falling, benzodiazepine drugs, antihypertensive drugs, hypoglycemic drugs, diuretics, laxatives. Male, GCS between 7 to 14 points. Drowsiness or dizziness, visual impairment, blurred vision, blindness, depression, abnormal sensation in the feet, difficulty in moving or standing, require the use of walking aids, first time getting out of bed after surgery or postpartum, require frequent use of the bathroom, previous falling experience within 1 year, hospitalization without a caregiver. The importance of fall prevention. The chance of injury after falling is as high as 30%. Results in bruises, scrapes, tears, bleeding, internal pain, internal bleeding. Severe injuries such as bone fracture, loss of consciousness, death. Hello, ma'am. My name is Wanling Hong, and I'm the nurse taking care of your husband. Your husband is a stroke patient, over the age of 65, unsteady gait, and he gets dizzy. So he needs assistance from his caregiver when getting out of bed. He's currently taking stool softeners and diuretics, so he will need to get out of bed and visit the bathroom often. Also, he fell in the past year, so he's a patient with high risk of falling. Let me teach you how to prevent falls.
Okay, thank you.
Ma'am, these two symbols are to remind us that this patient is prone to high risk of falling, so that we must be alert to prevent the patient from falling.
Okay, thank you.
Next, I will teach you how to prevent falling.
Okay, thank you.
First, when getting in and out of bed, lower the bed to the lowest height so that the patient doesn't lose their footing. Second, put down the bed rails when getting out of bed. Do not cross over it. Third, always keep the bed rails upright, especially for patients that are irritable, anxious, unclear patients. Fourth, items should be kept in cabinets to ensure that the walkways in the room are free of clutter. Fifth, wear appropriate clothing, shoes, or slippers. Do not walk barefoot. Sixth, keep the bathroom floor dry. If the floor is wet and slippery, contact one of the nursing staff. 7. If you need any assistance and there are no caregivers nearby, immediately call the nursing staff by using the nurse call button. 8. When in the bathroom, if there is an emergency, press the nurse call button in the bathroom to alert someone. 9. If the patient feels weak, they should use the bedpan or bathroom chair and reduce the number of times they get out of bed. 10th, when using walking aids, wheelchairs, walking sticks, or canes, slow down when transferring. We suggest that caregivers accompany the patient. 11th, when patients get out of bed for the first time each day or post-surgery, they often suffer from dizziness. Caregivers should offer assistance at their side. 12th, when getting out of bed, do it gradually. Start by sitting up and resting for 3 minutes. Then sit on the edge of the bed with assistance for 3 minutes. Once you confirm there's no problem of dizziness, then you can let caregivers help you out of bed. 13th, the caregiver cannot leave the patient on their own to prevent accidents while the patient is alone. 14th, when accompanying the patient on walks or activities away from the sick bed, never leave the hospital area. Ma'am, do you understand the above fall prevention methods?
Yes, I understand. Thank you.
I need to remind you of some special circumstances.
Okay, thank you. Wrong example 1. When the caregiver temporarily leaves or goes out.
Dad, I'm going out to buy some food. The nurse said you can't get out of bed by yourself, okay?
Okay. Oh.
Dad, why did you fall? Dad, are you okay?
I'm fine, it's okay.
Correct prevention method. When the caregiver is leaving, they must fill out the caregiver leaves patient status confirmation form by completing the fall prevention items below, and then filling out time and reason for leaving to be signed by the nurse in charge before leaving the hospital room.
Dad, I need to step out for a while. Do you need to go to the bathroom?
No, it's okay.
What do you need? Press this and a nurse will come help you. I'll place it here. Don't get out of bed by yourself.
Okay, I understand.
I'm leaving. Ma'am, I need to step out for a moment. Please keep an eye on my father.
No problem.
Thank you.
When returning to the hospital room, fill out the time of return on the caregiver leaves patient status confirmation form to be signed by the nurse in charge for verification. That's how you prevent patients from falling when the caregiver temporarily leaves or goes out. When the caregiver changes, the form should be re-verified and signed. Wrong example 2. Leave the patient alone after changing the sheets.
I'm going to go toss the dirty sheets. Lie here for a while.
Okay, I understand. Ow!
Correct prevention method. Once the caregiver changes the sheets, first help the patient lie down, then ask if they need anything. and tell the patient the reason for stepping out.
I'm going to toss these dirty sheets. Do you need to drink more water?
No.
Do you need to use the bathroom? Don't get out of bed on your own until I get back.
Then you can leave the hospital room. Friendly reminder: when helping the patient off the bed to walk or use the bathroom, use the bedpan chair or wheelchair. The caregiver should always be beside them. Return to the bed when you are finished, then raise the bed rails to ensure patient safety. Do not leave the patient alone on the side of the bed or on visitor chairs to prevent falling. Wrong example 3. Patients getting out of bed at night to go to the bathroom.
Oh, ow!
Are you okay?
Correct prevention method. At night, the patient should not leave their bed by themselves to go to the bathroom. They should wake the caregiver up and ask for help.
I need to go to the bathroom.
All right. Take it slowly, slowly.
Wrong example 4. Caregivers waiting outside the bathroom door.
All right, you can just wait here. Call me when you're done.
Okay, I will do, I will do. Oh! I can't get up.
Oh no, what happened? What happened?
Correct prevention method. The caregiver should accompany the patient into the bathroom and help them. Do not wait outside the bathroom.
I can do it by myself.
You're dizzy and your legs are weak. I'm afraid you'll fall. The nurse said it's safer if I help you in here.
All right.
Example 5. Take fall-related drugs.
Nurse, why are my legs weak and I keep going to the bathroom? What should I do?
Sir, it's because you're taking laxatives, so you'll need to go to the bathroom a lot. That's why you need caregivers accompanying you, or else you'll fall easily. It's very dangerous.
Okay, I understand. Thank you.
5 major categories of fall-related drugs: sedatives and benzodiazepine drugs, antihypertensive drugs, hypoglycemic medication, diuretics, laxatives. When taking these drugs, be careful of the following. If you require benzodiazepine drugs, please take it after going to the bathroom before going to bed. When using laxatives, diuretics, or benzodiazepine drugs, the caregiver should pay attention to the patient's bathroom needs at night. Caregiver assistance is required when getting out of bed. If any complications arise while taking these drugs, consult a doctor or pharmacist. Do not adjust medication or dosage on your own.
Ma'am, these are all the preventative methods for special circumstances. Do you understand them?
Yes, I understand. Thank you.
If you have any problems, feel free to talk to the nursing staff at any time.
Okay, thank you.
After watching this video, if you have any questions, consult a doctor or physical therapist. The telephone number is 04-723-8595, extension 7428.